Hello and welcome to Ask a Naviguide, part of the Abundant Aging podcast series, where we talk about aging and family caregiving and how to work through stressful situations with the help of the United Church Home's team of Naviguides. Our Naviguides have decades of experience helping families work through difficult situations. And today we have Robin with us who will help us understand billing and the appeals process. Welcome, Robin.
Thank you for having me.
Yeah, it's good to have you. So tell us a little bit about your background with this sort of thing.
Okay. So I was a senior healthcare insurance broker for about 20 years. I worked in claims for a couple years, and I was the billing manager for a home healthcare for 5 years before becoming a Naviguide.
Great. That's awesome. So today we're talking about the billing and appeals process with Medicare and managed care, a big subject that probably literally no one really wants to talk about. But today we're going to unpack some of those questions we might have with that. So we've all experienced a situation where we might have to correct a bill or something. But what about when it comes to healthcare? Where do we start? Who do we call? All of those things. So Robin, what sort of situations have you seen where there are issues or errors with medical billing?
Okay. Well, I would say it's more with a prior authorization. What I see most is when it comes to medical equipment. A good example would be if someone wants a walker that has a seat. Those are called rollators. Well, a lot of times the person will just go purchase one and then want to get reimbursed for it. What they don't realize is that that requires a prescription, just like your pills might, or a cough syrup or something like that. So you have to get that prior to purchasing the equipment. Otherwise, and what it is Medicare and the Medicare Advantage plans, they want the doctors to say, why does this person need it? They don't want just someone going and getting one for convenience sake. They want to show that they're having problems walking, that they've either fallen or they've had therapy but was not able to get to their full potential. Whatever the reason may be, there needs to be documentation to show that before the insurance companies will pay for it.
That's good to know. And I'm sure those things, you might walk into a place and find out without getting that, pre-auth on a rollator walker, and they say, well, it's hundreds of dollars,
Mhm.
and you weren't prepared to pay for that. And then it just creates an awkward situation. So it's good to know. So when we think of charges related to out-of-network status, is there anything patients can do to recover costs um, or get their insurance company to treat it as an in-network charge?
Yeah, there's an appeals process. I say this happens most frequently with medications. Maybe the
Mm,
doctor's wanting them to have a brand name medication, but the insurance company's saying, well, what about this generic version? And there are reasons. I mean, with brand names and generics, me myself on a typical item, I don't mind generics. But when it comes to medications, the difference is with a generic, technically, some of those ingredients could be just a little bit different than they are with the brand name standard. That's the reason why they are different. And
mhm.
so that's where I see that the mostly. And yes, actually, I'd say most of the time it does get overturned, but it's still a headache and it's still a hassle because the person might need that medication right now and they're having to wait to get, for the doctor to fill that out. And it's hard. I mean, the doctor sees several patients a day, and for them to take the time to fill that documentation out. Another thing you run into is that primary care doctors, they see such a wide age range that they may not be experienced with what Medicare and Medicare Advantage plans require in their documentations. A lot of times they might just put a check off of some boxes. They might put one diagnosis and think that's sufficient, but it is not. Medicare wants to see something written stating that you evaluated this person for this and this is what your findings were.
Mm. So they want all the information before they make a determination. Interesting. So I've wondered about this my whole life. So surely someone else has. But what about if you have an emergency when you're traveling outside of the US? Will your insurance company pick up the bill, or you just have to pay that out of pocket?
They can be very tricky. If you have traditional Medicare with a supplement, you probably will not have very many issues. Being on the claims side of things, and I love Medicare Advantage plans, they definitely have their place in this society and medical coverage, but it is different.
Mhm.
So with traditional Medicare, their standard customary fees are pretty straightforward. They don't require as many prior authorization guidelines, and they typically pay quicker. So with
Mm.
Medicare, traditional Medicare, you don't have as many issues. You'd be hard pressed to find a place anywhere in the country that is not in network with them. With Medicare Advantage plans, it can certainly be tricky. If you have a PPO plan, it may take a while, but they will still pay for out-of-network services. If it's an HMO plan, it just can be very tricky because HMOs means that there are no out-of-network benefits. So in a lot of those plans, again, we'll pay for emergency room, urgent care. It's really when you find yourself in a hospital setting for anything longer than 2 or 3 days is where you run into problems.
Gotcha. Interesting. And that's good to know. Because a lot of older adults save their traveling, in their retirement years, and so if something would happen, it's nice to know kind of. Not think we all ever think about when we're traveling, what might happen, but it's nice to have that in the back of our minds. Okay, this is what I need to do if something does happen. So let's talk a little bit about just like a hypothetical situation. So you've received in-network services, you've paid your copay, you met your deductible, but you still get charges you didn't expect. So what are the steps you would take to understand why that would happen?
You would want to call the number located on the back of your card, customer member services, and just ask questions, find out why. And it could be that maybe something was the diagnosis or not coded correctly. It could be that you do have a secondary insurance and they were not aware of it. Those are the most common things that I see. So sometimes before getting too worked up about it, there might be a good reason. So just calling the company, trying to get it figured out. There are appeals processes, which again, calling that number, they would help you find out what it is that you need to do, get you the proper documentation to fill out. You may have to then send it to your provider, that sort of thing. So it is a process, but oftentimes there are resolutions that can be had.
And is that very common where you might have to call and get charges reversed, or that is it a common thing for insurance companies to deal with that?
It's the most common that I get is either being coded as a preventative or not having the secondary insurance on file. Those are the two common things that I run into. Very easily resolved. The problem is that someone needs to address it right away because a lot of times if the hospital or the facility has sent it to a collection agency, it's actually out of their hands at that point. So you really want to stay on top of it. You want to call them as soon as you can.
In terms of talking with the insurance company or Medicare, how should you treat the representative? Is there any sort of like schmoozing that we should be prepared for, or what is your advice with dealing with them?
Be straightforward. Give them as much information as you can. Really, they're there to help you. They want you to keep their plan. They want to keep you as a member. So no, I definitely just trying to be upfront with them. My mom actually, when even on her behalf, if I'm calling for her, she always wants them, to explain that she has a bad back and she can't leave all these things. And I try to tell her that this person really, I don't want to say that they don't care, but it's not going to make a difference one way or the other for what it is that I'm trying to do. So,
Right. They don't need your life story.
no, just be transparent.
Yeah. It might not hurt to follow up with like, some flowers or chocolates or something to get I'm just kidding. So what information then should you bring to the call? I presume like your insurance card. Are there any other things?
Any bills that you've received, certainly. That way you'll have, any codes that they might want from you that maybe they don't have. Billing dates, procedure dates, which again, usually when you receive your bill, it's itemized. But yes, definitely have that in front of you. Have your insurance card. They usually look you up by your member ID number. So yes, those are the things to have handy. Maybe your doctor's name and address.
Well, Robin, as always, so much information, so full of knowledge, and we appreciate you being with us. So thank you so much.
Oh, you're welcome. It's my pleasure.
And thank you again for listening to another episode of Ask a Naviguide, part of the Abundant Aging podcast series brought to you by United Church Homes. If you like the show today, please like, share, and subscribe so we can bring you more topics on aging. For more information about the UCH Naviguide program, please visit uchnaviguide.org. And for more information about United Church Homes, visit unitedchurchhomes.org. We'll see you next time.